Dr. Mary Ansong is my guest this morning. She is the founder and CEO of International Sickle Cell Center. The topic we're discussing this morning, a very pertinent one, is sickle cell, its symptoms, causes, and preventions. Doc, before we went on the break, you were talking about some of the complications, right?
Yeah. So I was saying that with the abdomen, you can have either the spleen enlarging, it's called splenomegaly, or the liver enlarging, and sometimes you can have multiple complications. The body can almost literally like remove the spleen. So the spleen becomes so small that it's no longer seen, or you're not considered to have a spleen. And it's called autosplenectomy. The spleen protects you from infections and all that. You can have chronic leg ulcers. We have a patient who has had the ulcers for over 10 years now. And sometimes, if it's not well managed, she said, when I met her, it wasn't well managed. So fluid from the ulcer can fill the whole floor. And I asked her, are you dating? Are you married? No.
We'll come to that. Let's talk about the stigmatization bit of it. Right. Do people go through that stigma?
Yes, so many people. The woman I was talking about, who was telling me about her vision and all, her husband does not understand sickle cell disease. So when she's tired and she can't cook, when she's tired,
It becomes an issue.
yes, and he would beat her up.
Wow.
Interestingly, this man is a pastor.
I see.
Well, let me not go there. Okay, he will beat up his wife. And so now she wants to run away. And the children are all against her because he's turned them against her. It's very sad. And then we know of these patients as well. Their sister was having the pain episode, and the relative said her pain was a punishment from God because she's a witch. And that's why she's experiencing that pain. So they asked her to confess to witchcraft. She said she wouldn't. So they locked her up in an uncompleted building. This lady was having a sickle cell pain episode, eminent one. They didn't give her water, they didn't give her food, they didn't give her medications. 2 days later, they could smell something on the compound. When they checked, she was gone. The other siblings, they said, I'm not taking you to school because you would die soon.
Too bad. Doc, let's talk about the management. How do we manage it? Those that have it, how do we manage it?
I think home management is key. Because hopefully you don't have to be in the hospital all the time if you are taking good care of yourself right from home. So first of all, we need you to come to the hospital for regular review. If you are good, you can come every 3 months, even every 4 months, depending on how well you are responding to treatment. But if you are not very well, then we would increase your frequency of hospital visits. We'll put you on some medications. And now there's this medication called hydroxyurea, which really prevents complications of sickle cell disease, the crisis and all. So if we think you need it, we would put you on it, especially those who are SS benefits from it a lot. And then water. I tell my patients that water is the cheapest medication for people with sickle cell disease because it helps the red blood cells flow freely in the vessels. What sickle cell disease does is that, we've not spoken about that, it changes the shape of the red blood cells from a round, soft donut into the shape of like a half moon or banana. And these sickle-shaped red blood cells become sticky. So when they are passing through very tiny blood vessels, they can't pass through them. So they block the tiny blood vessels. Then any organ that's there, any tissue that's there suffers because they don't receive oxygen.
Right.
And then it causes a lot of pain and other complications. So water helps the red blood cells flow very freely. And if you have sickle cell disease, you should take at least 3 to 4 liters of water every single day.
Right. Doc, is there a community for sickle cell patients?
So I think it depends on where you are and then if they have sickle cell support groups. So IICC, we've created a community for sickle cell patients where they can contact us, speak to us. We provide them with advice and all. Our Rich Hospital today have one like that, which is very, very strong. But unfortunately, we don't have a lot
Right,
in
Doc,
Ghana.
we have just some few minutes to go.
Okay.
Your Instagram handles and all of that.
Okay, so our Instagram handles, Facebook, it's all ISCC
Yeah.
Ghana. That's International Sickle Cell Center
Okay.
Ghana. And they can contact us. You can contact us on 0599 599 211.
Okay. All right. Thanks so much for passing through, Doc. I mean, I have learned a lot. Hopefully, we'll have you here some other time.
Okay.
Too bad this is where we have to draw curtains on this morning's edition of the Breakfast Live Show. My name is Lebene Abrokwa. I have been speaking to Dr. Mary Ansong. She is the founder and CEO of International Sickle Cell Center. And we have been talking about sickle cell, its symptoms, causes, and preventions. Do have a very good morning till I come your way tomorrow. Enjoy your day.